Also new tonight, we're taking a closer look at the closure of Memorial Hospital 1 year later.
When the Pawtucket Emergency Department ceased operating almost a year ago, there was a list of conditions put into place. So we wanted to know, are the owners, state and city, holding up their ends of the bargain? Eyewitness News reporter Kim Kalunian joins us now with what she's learned.
Well, the mayor of Pawtucket is raising concerns, saying some of those requirements have not been fulfilled. But the state and Care New England tell me that's not the case.
We're sitting here almost a year later, and we're feeling the impact.
Pawtucket's Mayor Donald Grebian says his city has not recovered from Memorial Hospital's closure.
People are suffering now, and we need to make sure that we're focusing in on that.
When the health department approved the closure of the cash-strapped hospital in December of 2017, they imposed a long list of conditions, one being the state then appoint an independent consultant to monitor the effects of the closure on the community.
We actually started looking to try to identify an independent monitor who could do that work right away. We did run into a couple unforeseen obstacles that resulted in the schedule getting pushed out a little bit.
We've learned that a firm was not selected until close to a full year later in November of 2018, and reports that were set to be filed at the 3, 6, and 9-month marks never got done.
We expect to get an initial list of preliminary recommendations in the spring that we can then start to work with the consultant on to sort of hone down and refine. And then sometime in the early summer, we expect to have a finalized plan with formal recommendations.
We have the conditions. We met all the conditions. And I think people know that when we say we're going to do something, we do something.
Care New England CEO Dr. James Finale says his company has worked hand in hand with the state and the city to make sure patients have been taken care of in the wake of the closure. But Grebian says it's been less than ideal, even calling into question how Care New England is using Uber to fulfill another requirement to provide shuttle services for chronic care patients. Is that what you were envisioning?
No, clearly that's what I don't think what anybody was envisioning.
The real unique requirement was, can we transport people where they need to be transported as required by the conditions? We've met that. And I got to tell you, this service is much better than any shuttle service with a bus sitting at the hospital waiting for you to come. So we can go door to door. This has worked great.
So what happens from here, and what's to become of the Memorial campus? We'll have more tomorrow night on Eyewitness News at 11. I'm Kim Kalunian, Eyewitness News.